understanding recovery, did I understand you right? You don't even have data on how many people successfully go through that?
We don't have.
Excuse me, could you repeat the question, microphone, for people who will be listening in on it?
I mentioned that we don't even have a number of the success rate for recovery that's representative of the nation, not to say that it's representative for different types of addiction. And as I say, there are two issues that interfere with us getting that data. One of them is that people that have had a problem with addiction are dealing with a stigmatized disorder, so they are afraid to come up and say, I have a problem with addiction and I've recovered them. And we have stories where people lose their jobs when they are open about it. Because addiction, whether we want it or not, is still stigmatized in many environments. And one of the things that I always say is I encourage people to speak about it because we need to stop the silence. The only way we are going to stop the stigmatization is by speaking up. And that's why it's another aspect about why it's so brilliant, this idea of Dr. Bickel of creating a platform to do that. Allow people to speak up and allow others to recognize that it is possible to recover. Because what you see with addiction, being a chronic disease, is that relapse is part of the process. And when the person relapses, not only he or she is discouraged, but the family is discouraged. And the sense is that treatment does not work. When it's not that it does not work, it's that it is chronic and you need to restart and reinstitute. So knowing that others have been successful in recovering will provide the inspiration for the person that's battling that process of relapse to try treatment again. So you're achieving two things. So the one, I think it will be very helpful to change the culture and hopefully decrease the stigma. And another one, that's why I say it's going to provide a therapeutic environment for those that may have given up and realize that no, there are many people that are successful. And it will give us a better indication of how many people are able to recover.
So is this the future where research is going in your field?
I would hope so. I would hope that also that more research starts to go into the area of recovery. For example, the questions that Dr. Bickel was saying before, what determines, what are the active ingredients that can help you determine an environment where the person is more likely to recover? Or what are the active ingredients in terms of the psychological constructs that allow a person to recover? For example, their self-control. If they are optimistic versus pessimistic, try to get a better sense of what are the factors that in one subject may make them more likely to succeed and another more vulnerable, and then you can tailor an intervention to help that, personalize that intervention to help that person achieve recovery. So I would hope that these will help inspire other researchers to start to go into the field.
So two funding and money questions.
Yes, very important.
Any money from your institute going to help with this particular research? And two, is more money being directed towards these types of recovery research?
Well, that's a very important question. And Dr. Bickel is one of our grantees. So he's being funded by the National Institute on Drug Abuse. He comes, like any other researcher in the United States, with a proposal that is reviewed, and if it's fitted to be meritorious, he gets the funding. So it's in his interest right now, in his frontal cortex, to come up and design a study and sort of says, I want to do a study on recovery, and submit it as a grant. And so we are, and I would predict that we're going to start to see more investigators starting to get into this area of research, because it has become evident that we know very little, and that is, in fact, interfering with our success rate in helping individuals achieve recovery. Without the knowledge, you are at a tremendous disadvantage of how you can intervene.
So, yes, more money towards...
I need the investigators, and I would hope that we can fund more investigators that are looking into this area. And the reason why I'm being tentative is I cannot sort of say, we're going to put the money, because the money goes in terms of merits. Is this an area of importance for the Institute? Absolutely yes. And can very important science being done? Absolutely yes. So we need the grantees and investigators to come in with the proposals.
So, Jim.
So do you think there's many forms of addiction? So people may be addicted to gambling or sex, certain foods. Do you think that outside of just drug addiction and the mission of NIDA that we may learn something more about Dr. Bickel's study or more about recovery and people who have more generalized types of addiction, even obsessive compulsive disorder?
And that is a superb question. Should I repeat that?
Please.
I apologize. The question is, do I think that we can learn from Dr. Bickel's approach also regarding recovery of non-drug addictions, behavioral addictions, gambling, sex addiction, even obsessive-compulsive disorder? And I predict that we will. And in fact, for example, one of the areas that as a researcher I've been very interested is on looking at the overlap of brain dysfunction that happens between people that are addicted to legal or illegal drugs and people that are morbidly obese because they have this intense drive and inability to self-regulate that desire, the motivation to eat, because it's an enhanced motivation. So, and we found that by learning on one field, we can then apply similar models into the other, because there's a lot of overlap. After all, we only have one brain. And the way that you engage pathology has a tremendous redundancy. So succeeding, and so it's not surprising, for example, that the tools that we use for treatment of alcoholism or cocaine, Alcoholics Anonymous, have been translated successfully to help people lose weight. And it's also not surprising, therefore, that medications, for example, that in animal models work to interfere with compulsive eating, work with interfering compulsive administration of drugs. So I would not be surprised that factors that play a role in helping an individual achieve recovery from alcoholism, from nicotine, cocaine, will also play a role in an individual that has been battling all of his or her life in controlling their weight.
If I could just add a comment, I can't resist. Hearing about this exciting opportunity for understanding how people recover from substance abuse addiction just reminds me, and Dr. Volkow has commented on it eloquently, about the whole field of neurorehabilitation, which is just a fantastically exciting time. And whether it be a traumatic brain injury or a stroke, and so many different things that we're able to learn to recover function. And at least from my perspective, in addiction, we're really looking at processes that could be very similar, learning things that span a lot of areas. So I think it's really central to a lot of things, including those areas you were talking about. So, any other questions for Dr. Volkow? Yes.
Some of us here are involved with prevention activities and strategies, and one of the pieces of information that we use with young people and parents is talking about the later in life people delay their first use of alcohol or any drug, the less likely they'll have problems with the drug, especially addiction, later in life. So if I wait until I'm in my 20s to first start drinking, I have a much lower chance of getting addicted to alcohol. Is that something that, from your perspective, rings true, or just in terms of the brain chemistry and some of the research that you've been working on, does that ring true?
What you've said, actually, for alcohol has also been shown to be the case for marijuana. It has also been shown to be the case on tobacco, both based on the epidemiological studies that show that individuals that start for marijuana before age 17 are much more likely to become addicted later on than those that start later, as well as in animal models. So if you, for example, take rats and expose them during the adolescent period to cannabinoids or alcohol or nicotine, and then you test them as adults, you can foresee that the changes are different than if you had exposed the same amount of drugs but when they were not in adolescence but in adulthood. And today I'm giving a talk, and I'm going to present some of that data because the evidence is out there to support exactly your question. So the answer is yes. And from the prevention perspective, because that's where you're coming from, to me, what it clearly is telling us, we need to intervene as early as possible. Because if we can delay that experimentation with drugs, we may be able to really protect a person to go down the road of dependence, addiction.